Communications, and I'll be moderating this Q&A. We are recording this briefing, and that recording will be sent to everyone who registered. Thanks also to everyone watching on YouTube. Many states are pausing reopening plans as COVID-19 cases and hospitalizations continue to rise. With me today to discuss the steps needed to reverse that trend is Dr. Mark McClellan. He is a physician and economist who directs the Duke-Margolis Center for Health Policy, where he works on strategies and policy reforms to improve healthcare. He was previously Commissioner of the U.S. Food and Drug Administration and Administrator of the Centers for Medicare and Medicaid Services. Dr. McClellan, good morning.
Good morning. Good to be with you, Greg, and all of our participants.
Thank you so much. Right, well, we've got just 30 minutes here and a bunch of questions to buzz through, so we'll go ahead and get started. With hospitalizations continuing to rise, what kind of benchmarks should state and federal leaders be using to decide when to pause, reverse, or resume reopenings?
Well, Greg, hospitalizations are actually a good benchmark. That's a sign of health systems getting strained and hopefully not to the point where we'll have to approach crisis levels of care. I think the good news with these trends, certainly the upward trends themselves is not good news, but the good news is that we're seeing fewer people hospitalized out of the new cases, and we're also seeing better outcomes for the people who are hospitalized. That's a reflection of more of the cases being in younger individuals. There's been a shift in who is coming down with COVID-19 infections, with more older Americans clearly taking more steps to be careful, to follow the guidance about avoiding infection. Unfortunately, we're not seeing that among many of the younger communities, but we're also seeing some improvements in care. And this has been reflected in headlines I'm sure you all have seen around new drugs like remdesivir helping other drugs in development that may be coming soon, and old drugs turning out to be quite useful as well. Drugs like a steroid that reduces inflammation, not something you'd use for people at the early stage of the virus, but since the serious cases involve very much an immune overreaction in many patients, that's helping. And there are a few more treatments I think are close to providing even more assistance. So what that means is it's even more important than ever not to overwhelm our healthcare systems, because we can do more to save the lives of people who are having very serious cases. But of course, if we really want to have a safe and stable reopened economy where people are confident about going out, where we're not worried about our healthcare systems reopening successfully, we have got to get these trends in at hospital admissions down. And the other piece of bad news here is that hospital admissions are a lagging indicator of how the virus is progressing. It reflects activities from 10 days, 2 weeks ago in terms of how people and businesses are actually transmitting the virus. And so it's going to get worse before it gets better in many parts of the country. And the things that we're doing now need to be done with an eye towards reversing trends that are going to be in a worse place in the days to come than they are today. That's especially important with July 4th coming up. And I know a lot of people feeling like they've had a really challenging time already to get through these last few months. We just encourage people to take a step back as we look at these statistics, like around case trends and hospital admission trends and burdens on healthcare system. I think things are going to be significantly better in terms of the treatments that we have available in a matter of months. And that means we may be able to relax a bit more. And the big picture, the long-term stresses that this country has faced over years, decades, it's centuries. These months are not a long period of time. But for the coming months, in order to contain the outbreaks, we're going to have to do better than we've done so far.
Gotcha, absolutely. Thanks for that comprehensive introduction. We're going to open up to questions shortly. We've had some questions in advance, and this one digs into some of the stuff you were saying about messaging, and especially, that it seems like younger people are not necessarily getting the message. So a question we had from Dan Goldberg with Politico says, what do you think needs to happen in terms of messaging to dig ourselves out of this hole? What specifically does the federal government need to say or do to help reverse the trends that we're seeing?
Well, I think the federal government is saying a lot of the right things. I'm just not sure it's been easy for people to get their heads around. For younger Americans, I think it's understandably been challenging to be isolated for so long. at an important period in their lives from the standpoint of working, getting out and doing things. But I think it's important to realize that there are two challenges here. One is that for younger people, one is that they do have serious complications in some cases. So a larger part of the hospitalizations that we're seeing now, even though the rates are out of the total cases is lower than they used to be, some of them are very serious cases and deaths involving younger Americans. So this is a direct health risk. The other thing that we've clearly seen is that your behavior is just not about you. I mean, we're all in this together. The models show that unless we get quite high rates of people following the basic steps, and there are not that many of them. It's distancing whenever you can. It's using a mask whenever you can't, and trying to not make those interactions last for too long with too many people that you don't know. So less than 10, less than 15, 30 minutes. It's washing hands and hand hygiene, and it's staying home, staying isolated if you have any symptoms. If we did those things, and would add one more to that, if someone who's been close to has COVID-19, it's important for you to stay in quarantine, for you to stay by yourself as well until you get tested and find that you don't have it. If we did those things at a high rate for the next 6 months, we would contain the pandemic. And I think for people who are younger, people who don't look like me, they probably need to be hearing this, not just from government officials, but from people who are in their circles, their influencers, people who they respect, about how we are all in this together and what they do with their actions, just in these specific areas I just described for the next few months, for the next 6 months, is really going to save lives if they take these steps. And I think it's really hard to see. It's really hard to get your arms around, people who I think if they were feeling sick, they wouldn't think twice about, okay, I'm not going out because I could get somebody else infected. What's really tough with this virus is a lot of the transmission occurs from people who don't have any symptoms at all, and or just have very mild symptoms. So it's a real change in behavior, but one that I think we can make more progress on. If you look at some of the numbers with the outbreaks over the past week, there is a bit of an increase in people taking more steps to be isolated. And we've seen a response from governors to try to shut down or take more aggressive steps in areas where there have been lots of transmissions, bars, water rafting. Was just hearing about issues in Texas, beaches where people are too close together. So there's some more steps we can do to help, but it is important for everyone to recognize just how much their own behavioral choices in these 4 or 5 specific areas really have an impact on the health of all those around them.
Gotcha. Thank you very much. We've had a number of other related questions related to masks that now makes sense to bring up. One of them says, what does the evidence show is driving the resistance to masks? Like, is there any sense of like why, when it seems so simple and not a big ask, why there is this resistance?
I think partly, Greg, it's people thinking that this is about themselves and their choices, and Americans are people who, that's our culture. We're about independence. We're about the right to make our own decisions. And I think a lot of people have looked at this, especially younger people, and concluded, I'm not going to get that sick, or there's not much of a likelihood that I'll end up in the hospital or dead, even though there is some chance of that, and concluded, I just don't want to take this step. On the other hand, I think if people view this more as being about not only their own health risk, which is real, but also about the health risks of their family members, their neighbors, others they come in contact with. We've seen behaviors change in other areas. Think about like secondhand smoke, where something that you might do that you might be fine if you're by yourself, but isn't fine if you're around others, could be a real problem. So I think reframing this more about not just that there is a health effect for you, there's also a health effect for people that you care about, and people hearing about this, just like they've heard in other areas where their behavior influences others. will make a difference. It is hard because we're asking people to do something when they feel perfectly well. That is a new restriction, but the masks do work when people adhere to them. Just like spending more time at a distance, not going to big so-called congregate settings, that does work. And those steps, if we did them at a higher rate, would contain these outbreaks.
Gotcha, thank you. And before we move on from the masking, one other advanced question we have: how much difference could it make in the spread of this disease if the president wore a mask and tweeted that to his millions of followers?
Well, I think that would help. You know, the president's living in a different environment. He gets tested every day. Everybody who comes in contact with him gets tested frequently. If we could make that kind of support available to everyone everywhere, then maybe we wouldn't have to wear masks as long. And actually, a lot of the work that we're doing at Duke is focused on how do we get the supply of diagnostic tests and other supports up to give people a little bit more confidence about the behaviors and the settings where they need to work together, like in business or at school. But we are not in a position where we can do that. And I think you've seen some really good leadership examples from Republican governors, from other political leaders in both parties about the importance of masks. I think it would help if the president did it too, even recognizing he's right. He doesn't have to do it to be safe in his kind of more bubbled environment. But it is important for the rest of us that aren't able to live that way.
Gotcha. Thank you. So I remind everybody that you can ask questions via the Q&A window if you want. If you're joining us on Zoom, you can also raise your hand in Zoom and we can unmute you and you can ask a question yourself. If you're joining us by phone, you can press *9 so we can unmute you. We're going to get through as many questions as we can. However, you can follow up with us via email afterwards and we can answer any remaining questions. But while we're waiting for additional questions, Mark, I'd like to ask you, you wrote recently that more COVID testing needs to be channeled to people in vulnerable communities.
Yeah.
Why is that especially important?
Well, it's that's where a lot of the outbreaks are happening. The evidence, we knew it from the start, but the evidence over the last couple of weeks has become overwhelming that the virus impact has differed enormously across different racial and socioeconomic groups. And if you look around the country, where we're seeing fourfold differences in hospitalization rates, large differences in mortality rates, and if you look around the country, we are not yet even in terms of access to testing. In many parts of the country, it's possible now that we've reopened healthcare to some extent. If you need an elective procedure or a visit, an MRI, you can get a test through your healthcare system pretty quickly, get the results back in a day or two, go in, do your appointment, and get the services that you need fast. But in contrast, in some of the same regions of the country, if you have symptoms and you're out in the community and you need to know, is this COVID or not? Do I need to stay isolated? Can I go about my life? It can take several days to get an appointment, or you've seen the pictures and the videos of hours-long wait at some of the community-based testing facilities. And even after that, it can take extra time because a lot of the clinical labs are backed up with many of these tests in conjunction with the outbreaks. It can be 5 days a week between the time you have symptoms and the time you can get your tests. And that is not good for containing the pandemic locally. So what we've advocated for is trying to get our test capacity up. But in the meantime, let's try to redirect a bit. Let's try to help healthcare providers that have been doing so much to deal with the surges, to get them more involved in helping with these community-based public health containment efforts too. And there's some examples of that around the country, but we'd like to see more payments going to healthcare providers. This is a critical time for reopening the country, and we can't do any other business as usual. We can't do healthcare business as usual either. We need to make sure people get the critical so-called elective services they need, but we also need to provide some more help for containing these outbreaks, for healthcare providers counseling patients what to do if they have a positive test, getting involved in providing some of this needed test capacity. And right now we're not paying healthcare to do that. We're paying them just to do the procedures and to try to reopen. Again, that's important, but this has to be a new kind of reopening as we get through these surges.
Sure, absolutely. Thank you. We've had an interesting question from Colleen Quigley at CBS 17. She points out that the groups advocating for reopening have said that the 2017 flu numbers were worse than the current COVID numbers. Is that a fair comparison? And what's important to keep in mind when comparing COVID-19 to the flu?
No, I don't think that the numbers are worse. I think sometimes people look at the case fatality rate, which, like I said, has come down, and we've probably underestimated we've definitely underestimated the number of people who have COVID. And so then if you look at, total number of cases as a denominator, number of people who have died, that number looks low compared to many flu outbreaks. But that's not the only number that matters. The other number that matters is how many people, and not only how many people die, but as we're just talking about, how many people get hospitalized, how many put real pressure on the healthcare system, need to come in and take intense measures to save their lives. And we're getting better at that. And that number is far, far larger. That's where the spread of COVID has been so much more difficult to contain than the spread of a typical flu outbreak. And by the way, we also have a vaccine to help us contain the flu outbreak, which we don't for COVID-19. So yes, if you just look at the mortality rate, the so-called case fatality rate, that doesn't look bad compared to flu. But if you look at the total number of people who've been infected, the total burden on the healthcare system, and the total number of deaths, this is way, way worse. It's not at all an even comparison.
Gotcha. Absolutely. Thank you. You have, in your recent work, you've mapped out a number of important steps to control the current outbreak and future COVID outbreaks, to treat the people that have the virus, and to prepare to treat or vaccinate those in the future. Can you walk us through some of those steps?
Yeah, so one of the steps we've already talked about is let's bring additional resources to bear. So our country doesn't have an extremely well-developed public health system. We've had new funding come in through federal legislation, through actions by the administration, and then through actions by all the states, using some of those resources to build up our capacity to do testing, to trace contacts, to help go in areas where there are big outbreaks like nursing homes or meat processing plants. That's a very important public health response. We need to augment it. So we talked earlier in this discussion, Greg, about some of the steps that we think healthcare can take, sort of the new reopening in the COVID-19 era that puts more emphasis on reaching out to people who are at risk, helping them get tested to identify if they got a risk, helping them stay home to manage COVID-19 and put less pressure on the hospitals and on the ICUs, but also more steps like we started seeing this spring with telehealth and other services that can be delivered at home or in the community, supported by technology, so that people, especially those at risk, don't have to come in quite so much. I'd like to see more of that. If you look around the country, there are programs that are doing everything from mental health service management at home to helping people with chronic diseases so they can get their medications, they can be monitored for symptoms and for blood pressure and things like that, all from home. And even people with serious conditions. Some of our worst outbreaks have occurred in dialysis centers where people with end-stage renal disease have to come to get the dialysis treatments 3 times a week that they need to live. But it turns out there are new technologies now that are more widely used elsewhere in the world, like peritoneal dialysis, which you can do at home, have fewer complications, easier for the patient, lead to better outcomes and lower costs. We just haven't supported them very well. So more healthcare shifts in that direction, paying healthcare providers more to help people, including with very serious conditions, stay at home is an important part. And then we've got some important roles ahead in the business community as we try to reopen schools, as we try to reopen more of our major business activities. We clearly have a lot that we can learn about how to do that safely, and also about how to use testing in that context. So there are new tests coming along that can be used more widely, so-called point of care tests that I think will be a part of successful school reopening, university reopening, and many businesses reopening. We haven't got all of those tests in place. We don't have as much evidence as we'd like on how to use them effectively, and also how to protect the privacy of individuals and students involved. So that's another area where we can make more progress quickly, and that'll reduce the risk of reopening in business or reduce the risk of reopening in schools. Healthcare support for these reopening steps along the lines I've described, that will all supplement what we're doing through public health and what we need people to do, these specific changes in how they're acting when they go out to help us get through these next 6 months. This is not going to be forever. This is a matter of months. But I think if we take the steps we've just talked about, we can do it successfully. We're not there yet, though.
Gotcha. Thank you. We're up to 11:50, so we're going to try and race through as many questions as we can here before the end. We've had a couple of questions come through the Q&A. One that says some European countries that had exploding rates of COVID-19 months ago are now reopening and seem to have the virus somewhat under control, whereas we don't here. Do you think that's because of more testing and better following of safety directions by citizens and national shutdowns by government, or slower reopenings that they've had, or all of the above? Why have other countries done better?
It's all of the above. I think some of the most important factors were many of their initial shelter in place orders were actually stronger than ours. Back in Italy, you could not go out. So they did an even tougher job of really driving down the spread of the virus and the availability of the virus. And then when they opened, they waited until they were seeing significant declines in cases. They put in place the testing, the contact tracing, steps that we're doing here. But when they did so, they had a declining and lower number of cases that they had to manage. And if you're dealing with only a few leaks in the dam, it's easier to patch those up and versus if the water level is rising and there are many more leaks. And that's kind of the challenge we're having now. It's very hard, even with a lot of increases in testing, which we've had. We're over 3-4 million tests per week, headed to 6 million, some of the biggest numbers in the world. But if there's so many more people who have positive cases, we're still overwhelming our testing system. And I talked earlier about how it can be 3-4 days a week to get a test and get results back if you've got symptoms. And that is way too slow to enable effective contact tracing. So what we'd like to get to is slow down the cases. That's why many states are pulling back now, get to the point where we've got changes in behavior that show we can reopen without seeing big spikes in cases again, and then augment that with enough testing and tracing capacity to get ahead of these outbreaks, rather than trying to catch up from behind, like we're doing with the rapid spread, the epidemic spread that's taking place in many states today. And that's more like where many countries in Europe are that are now able to reopen a bit more successfully.
Right, absolutely. You've talked about how important testing and contact tracing are, to getting a hold of this thing. How important is it that local governments get involved in that effort, and how can local governments go about implementing effective tracing programs?
Well, local governments are getting a lot of support for that now. So there's been significant federal funding in the CARES Act that's gone out to states to support setting up local contact tracing programs. In addition, the federal government is continuing to provide some pop-up local test sites to augment places where there are gaps. But every single community, every single mayor, every single county needs to have a strategy around this. And we're seeing more of what the best practices for this are. At Duke, we're working in collaboration with the Rockefeller Foundation, which has put a lot of resources into identifying some of the best ways to set up these programs and to help them get more access to the testing capacity and the contact tracing that they need. But I'd add a couple of other things. As I mentioned before, it's hard for local governments to do this by themselves. They need help from healthcare. They need help from businesses, and both healthcare and businesses could do more. For example, I'd like to see Medicare start paying not just for when healthcare providers give a patient a COVID-19 test. That's good for providing more access to testing, but also for counseling. It turns out, maybe not surprisingly, that when people hear about what they need to do if they have a positive test from their doctor, from a clinician that they trust, they're actually much more likely to take the steps than if they just get called cold after they get a positive test, say, hey, you have a test, you need to isolate, you need to tell us who your close contacts are. If they get that kind of counseling in advance from a healthcare provider they trust, when they're getting the test, say, if this is positive, this is what you should expect, and here's why it's important for you to let us know about who you've been in touch with. Here's why it's important to isolate. In that case, it makes a difference. So that's an example of augmenting the local responses with better coordination with the healthcare providers in the area.
Gotcha, absolutely. I think we've got time at least for one more question if we're quick. The fall, it's already been evident that summer has not brought about any kind of cessation of this virus. Yeah. But how concerned are you that the fall could bring a resurgence, even if people are doing the right things with distancing and masks and so on?
Yeah, very concerned. That's why we need to, despite the difficult circumstances with the epidemic under now, we need to keep strengthening, and we need to be very cautious about continued reopening. I fully support the pauses and the further steps that states are taking locally to identify where there are big outbreaks and trying to make sure those don't happen again. Keep getting to better containment. Despite all of this, latest estimates we have from the CDC, even though the total number of diagnosed cases is only about 1/10 of the total cases we think are out there, we're talking about maybe 7-8% of the population that's been exposed, infected, and hopefully in most cases is recovered. We're not even completely sure about how long immunity lasts if you have recovered. This is a virus that spreads rapidly enough. Its infectivity and reproduction rate is high enough that we need to get up to something more like 60%, 70%, or 30 or 40% with only modest changes in behavior before we can really get to contain spread. So for the months ahead, and I'm talking 6-8 months, probably not years, but not 1 or 2 months either, we need to take the kinds of steps that I've just described today. We are not there yet in terms of containment, even now in the summer. This is still part of the first wave. It's just the wave that got delayed from places like New York and New Jersey and New Orleans that got hit first. That's happening now, and could have similar tough consequences if we don't act. So good news is we've got better capacity in place in our healthcare systems, but it is not unlimited. It does not take many people to overwhelm a healthcare system. Texas having about 6,000 cases a day. That's out of a population of close to 30 million. So very low rate in the overall population, but it's enough to put their healthcare at stress in many regions of the state. It really does mean we all need to take these steps very seriously and make some collective choices that can help us get to containment. My hope is that by fall, we'll have more testing in place. We'll be more like Europe in terms of being able to get ahead of outbreaks that are occurring. We'll have stronger systems in place in businesses and schools to contain outbreaks. We'll have a healthcare system that's adapted and that's not only adapted well to dealing with the people who need ICUs and ventilators, but also helping to contain in the community more along the lines we've been talking about. But it's going to be a very tough fall if we don't make real progress in all of these dimensions.
Absolutely. Thank you so much, Dr. McClellan. We will leave it there as we've reached time. Thanks to everyone for joining us. There are a couple of unanswered questions out there. I will follow up with you via email to get answers to those questions. Thank you, Dr. Mark McClellan, for joining us. Thank you to all reporters for joining us. Please come back next week. We'll be discussing the impact of the pandemic on children and tackling some of the issues involved with the reopening of schools. If you'd like to be included on that advisory, please email dukenews@duke.edu. In the meantime, thank you once again for joining us, and please stay well. Thank you.